Hi everyone. The present electrocardiogram belongs to a 90-year-old female, known case of hypertension and rheumatoid arthritis, presented to emergency department with generalized weakness. What do you think about the surface EKG? Which one is the correct interpretation? 1. Sinus rhythm with frequent PACs and left bundle branch block. 2. Atrial fibrillation with left bundle branch block. 3. Wandering atrial pacemaker with left bundle branch block. 4. Sinus rhythm with frequent PACs and acute anterior myocardial infarction. Comment your answers for me. Full interpretation will be published in next few days. By the way, if you are eager to test your skills in EKG interpretation, subscribe me and ring the bell for next cases.